Hello, everyone. It is Focus on It Friday. Come on in the room. Come on. It is now time for us to do what we do every Friday at noon, and that is to talk and learn and have a good time. Hi, Amber. Come on in. And we are going to have a good time. I had some folks waiting on me today. Hi, Miss Dina. Hello, Amber says. That's my beautiful niece. She's down in Mobile. Thank you for joining from Mobile. Hi, Mommy. Thank you for joining. And Miss Dina is over in Fayette County. Thank you for watching. And Priscilla. Hi, Sis Priscilla. Come on in the room. She said she was not going to forget today. That we were doing our Focus on It Friday. Auntie Louise, come on in the room. Yay. It's Friday. Hi, Dina. Come on in the room. Can you all hear me pretty good today? Let me know if you can hear me. There's Karen from Albany. Hi, Karen. Thank you for bringing in the East Coast. Auntie Rosalind, hello. Come on in, Miss Misty Tucker. I see you over in Lamar County. Come on. Hey, cousin. Hey. Up in Huntsville. Let's see. Mama says, I am here. Alicia, come on in. Hello. Elise Case. Hello. I know you are today. Miss Case, come on in. Thank you, cousin. She says she can hear me well. Thank you. Hello, Miss Misty. Thank you. Well, thank you, Auntie Rosalind. She says, I'm looking beautiful. Hello. Lady in blue. Thank you. Look, cousin Sharon. Hello. Thanks for watching. Hello, Miss is that Halfcock? I hope I said that right. Hello, Miss Halfcock. Now, when I get off, I'll go back and look at these pictures and I'll say, oh, I know. Hello, Miss Sadie. Hello, Connie. Hello, Regina Foster Robertson. Ooh, pretty. Thank you, Miss Dia. Let's see. Miss Dia's coming over from Fayette County as well. Hello. Good afternoon. We got Miss Cynthia Brown. Hello. Looking mighty pretty. My mama says, thank you. Let's see. Miss Valerie Williams. And y'all, I'm sorry. I can't see these pictures. They're super small. Hello, Miss Connie. Thank you all. Look so pretty. Thank you. We're going to give everybody about one more minute. Oh my goodness. We're up to 22 viewers that I can actually see. So I'm excited. Everybody is ready to learn and I am ready to teach. Auntie Louise says, I can hear you well and I'm looking good. And Valerie, I know Valerie now. Hey, Sora, I know who you are now. And my cousin Thomas from up in Cleveland, another East Coast person. He didn't leave you by yourself. Karen, thank you so much for joining in on our Focus on It Friday. I'm going to give everybody one more minute and then we'll get started. Y'all know the weather's always beautiful on Fridays around this time, and I'm excited about that. We're holding steady. I think this makes like week 16, and the weather is good. Now, it may have been raining before or even after on a Friday, but we are having some good weather on these Fridays at noon Central, and of course, that's 1 p.m. Eastern. Hello, cousin. Thank you for joining. Just a few more seconds, and then we will get started on our Focus on It Friday hot topic today. All right, well, I'm going to go ahead and get started. I am Dr. Brandi B, your triple boarded child and adolescent psychiatrist. Through my live webinars, my events, my speaking engagements, and my coaching series, I help worried, overworked, overwhelmed, and plain old tired moms of children with ADHD and today autism figure out what it is and get the education that they need so that they can help their children be engaged and be empowered to know that they can do well in the classroom and in life. Hair is so pretty. Thank you, Auntie Rosalind. So today we're going to talk about a pretty hot topic. We're going to talk about autism spectrum disorders. Now, I'm sure that everybody in the audience today, whether you're listening now or listening live, and by the way, if you're listening live, please go ahead. I'm sorry if you're listening to the replay, go ahead and type replay, just as a way to keep this bumped up. And this is going to be some good information. I don't talk about autism a lot. I diagnose it a lot. And the people that work with me say, well, where did she get that from? And that's because I'm very comfortable with it, because I actually trained at IU, which at that time was one of the 3 training places in the country where we had autism centers associated with our facility, and so residents got to train there, our child psych residents. So I'm very comfortable with it, trained under some great names in the field, but it's just not something I talk a lot about because ADHD is my thing. But apparently you all are telling me that autism is my thing too, so we're going to talk about it. Hello, Miss Ashley, glad you could join. Hello, Nikita, thanks for stopping by. Hello, Miss Luella, thank you for coming over. We're talking about autism spectrum disorders. So you're going to see me looking at my notes. That's because I want to do 2 things: keep myself on track and make sure that all these notes that I've jotted down from all this stuff going on in my brain, that I have all this knowledge, I want to be able to share it with you. And I'm still going to miss some stuff, but we've got part 2 today, y'all. This is the first time that we are going to do a part 2, but I know it's going to be a lot of information. And so to break it up, let people get back to work, because some of y'all are probably sneaking on your lunch, and I appreciate you all doing that for Dr. Brandi B. But I do want you to be able to listen again if you choose to, have some questions, come back at 6, bring yourself something to drink, make sure you're settled, and we'll do this all again. But it will be different, okay? It will be different. So tell all your friends that part 2 will be different. But let's go ahead and jump into it. So what is autism spectrum disorders? Autism spectrum disorder, rather, is a neurodevelopmental disorder, okay? Now, we call it developmental because you are going to see the effects of it before a child turns 2. Hello, oh, world-renowned Dr. Brandi B. Miss Cecilia says, thank you so much. I didn't get a chance to speak to you, but that was worth seeing. World-renowned, exactly. Speaking into existence, honey, that's what we're going for around here. But it is developmental because it is going to impact children around the age of or before 2. Parents are going to start noticing that something is different about their children around the age of 2. So developmental. Hello, Miss Lisa. Thank you for joining over from Fayette County. Thank you so much. All right, so it's developmental for that reason. Neurologic, some people say, because there are some neurologic components that you can see. There may not necessarily be a part of the diagnosis, but they're definitely there. And so there are some things that we see from a neurologic standpoint as well. And so it's a spectrum because there are people who can be completely typically developing, and then there are those who need a lot of help and develop in a way that is a little bit atypical. And either is okay, but that is why it's called a spectrum. A lot of times people will say, well, he doesn't look autistic. Well, that's because autism doesn't have a look, much like being a human doesn't really have a look. There are certain things that make us similar, but there are probably many more things that make us look different. Our bodies internally function the same, but for the most part, when we look at someone, we can't just necessarily tell who they are or what they're made up of. Hi, Amanda. Thank you for watching. All right. I think I know who Amanda Card is, I think, but I'll have to look at the pictures a little bit later. So we know it's neurodevelopmental, and we know that it is a spectrum. Now, it's important to note that it is a lifelong disorder. So people will say, well, how can you treat it? And you really can't treat autism necessarily, but you can treat some of the symptoms and other problems and difficulties that individuals will have. You can treat those, but in and of itself, autism does not have any particular treatment. Hello, Janterica. Thank you for watching. And Dejanay and let's see, Mr. Dunn Williams. Thank you all for watching. All right. So lifelong disorder, not necessarily any treatments. It is important to talk about right here nomenclature. Now, y'all know, if you've been following me, I'm going to tell you a lot about, I'm going to give you the background, the stuff that you probably don't really know, and you've probably read it, but you're like, I really don't know what that means. And I will do a lot of comparison to ADHD just because you know my style from talking about ADHD, and so I will carry that over. There is some nomenclature, or the way that we name the disorder, that has changed. So just like there is no longer ADD, and it's all ADHD and a way of presenting, okay, right? There are 3 types of ADHD. There is no longer the nomenclature that we use for autistic disorder, all right? So when the manual changed that we use to make our diagnoses, and it became a 5th manual in 2013, certain other names went away. There were 5 disorders that made up what was called the pervasive developmental disorders. And those were autistic disorder, Asperger's disorder, Rett's disorder, childhood disintegrative disorder, and pervasive developmental disorder, NOS, or not otherwise specified, which meant that you had a lot of the criteria for a lot of different things, but you really just did not meet the criteria. And so in mental health, what the term that we would often use would be NOS, or not otherwise specified. Well, in 2013, that nomenclature went away, and all 5 of those disorders fall under the one umbrella of autism spectrum disorders. Okay, so autism spectrum disorder. So remember, it is a spectrum. Somebody could be president of a large corporation or of a country, and somebody else may need total care and help for everything and all in between. So that's a little bit about it. Now, when we talk about what makes up autism, so what makes up autism are going to be 2 things. And just so we make sure, it's awe, like I'm in awe, not R, not artist, but awe, AUTISM. So people with autism can be artistic, but I want to make sure that we're saying it right so that we know how to spell it and pronounce it as well. But if you said it to me, I would know what you were talking about. It wouldn't be a big deal. But over here at Dr. Brandi B, you know, we educate people, okay? So you at least have heard how to spell it and how to say it, and I'm in autism. 2 things: social communication and social interaction. So primarily it is a disorder of social abnormalities, okay? But then the other thing that happens in autism is that you have these restrictive and repetitive behaviors and patterns that kind of spill over into your activities and your interests and also your behaviors, okay? So social communication, social interaction, that's the one part. And then the other part is going to be these repetitive, restrictive interests, behaviors, and activities, okay? That's very important to know. That's what the basis of the whole disorder is. Hello, Auntie Wanda. Hi, Miss Shirley. Thank you for joining us. All right. I've already talked about what makes up the spectrum and how we've now included all of those other diagnoses in. So now we don't have those other names as much. Just a quick word about Asperger's, though. It's very important to recall and to recognize that people who have Asperger's, they really identified with that disorder. It was something that made them unique and made them special, and they had quite a large community. And so they were devastated in some ways when really hurt when the naming changed, because Asperger's and autism at that time, or autistic disorder, the people who had Asperger's were typically what they called higher functioning, and they could go out into the workforce and could hold jobs. They didn't have the speech problems that were typically associated with autistic disorder, and so it was, you know, a letdown for them to know that diagnosis would go away. So you still may hear people talk about Asperger's, but I just want you to know, because you're over here at Dr. Brandi B, that it is no longer a diagnosis in our manual. Hi, Miss King. Thank you for watching. Always a pleasure to have everybody coming on in. So a little bit of fact. Here's some numbers. And these numbers are going to vary greatly, and that just speaks to the fact that there's so much to be learned, so much that we still need to know. But just to let you know a little bit about the numbers, 2018 is where I'm getting most of these numbers from. But 1 in 37 boys, so let me go back. 1 in 59 kids is going to have autism spectrum disorder, or ASD. That's pretty common, okay? 1 in 59. Of those, 1 in about 37 are going to be boys, and 1 in about 132 or so are going to be girls, which means that it's 4 times more common in boys than it is in girls. 4 times more common in boys than it is in girls, and we don't really know why that is, but it's 4 times more common in boys than it is in girls. Most of the time, diagnosis will be made, or you will at least start to see symptoms around the time that a child is 2. The diagnosis may not actually be made until 4 and even older. I diagnosed a child this week who was in middle school. He was at the end of middle school, and I made that diagnosis. You know, I've only seen him 3 times, and there were some things that I picked up on the first time, and the second time of this week I felt comfortable going ahead and saying to Mom that we needed to do. Now, it usually doesn't take me that many visits, but again, I fall prey sometimes to the, well, he doesn't look you know, like he has autism, and so that can sometimes get in the way. All right, so boys are 4 times more common, and 1 in 59 is the number. 40% are going to be nonverbal. So what does that mean? That means that 60% of kids who have autism can speak. And so that, you know, a lot of people, again, we have our ideas about what autism is, and we can let that get in the way of making a diagnosis. But I want you to know that 60% of children with autism actually talk, and they can talk well. A lot of them didn't even have any developmental problems with their speak. So we can't let that cloud our judgment about what it looks like and who may have it. When it comes to intellectual deficit or intellectual disability, I want to talk about the nomenclature here because it's very important. So mental retardation is a term that is no longer in use. That went away with our manual as well. So we do not use MR, mental retardation, retarded, anything of that nature. Now we talk about an intellectual, okay? And so about 1/3 of your children with autism are going to have some intellectual disability, meaning that their IQ is going to be less than 70. All right, about 1/4 or 25% are going to have what we call borderline intellectual functioning, which means that they are not low enough to have an intellectual disability, but they don't quite meet the mark of about 80 to 85, which is where we say that your intellectual functioning is typical. So they're going to in that 70 to 80 or 85 range. And then the rest of the people, which is going to be about 44%, are going to have typical IQs, okay? So something else for us to think about when we think about this child can't have it because, oh, he's smart. And 44% of them are smart. It's also important to note that when we talk about intellectual disability, it's more than just a number. Hi, Allie. Hi, Nita. Hi, Deborah Williams, for joining. So it's more than just a number. No longer can we say, and we really never should have, oh, his IQ is this, so he is this, and he's going to be able to do this. Because there are some people who have a specific number, but still don't meet what is expected of them as far as performing socially in the classroom and otherwise. And then there are some people who perform above level. So the number alone is just a number, and we need to make sure that we're looking at the social pieces and everything else, the speech pieces, everything that goes into a person's intellect. I do want you to walk away knowing that 44% of children with autism spectrum disorders do have average IQs, okay? Autism affects all races and all socioeconomic backgrounds. However, it is important to note that children who are minorities get diagnosed and enter treatment at a later age. Okay, they get diagnosed and enter treatment at a later age. That could be its own conversation right there. And you could probably have some thoughts about why that may be. But just know that it affects all races and all socioeconomic backgrounds about the same, okay? The only difference is going to be with sex, where boys are going to be affected times more than girls. Hi, Amanda. Hi, Tanji. I hope I'm saying that right. Just let me know if I am not. All right. Early detection and early treatment are the best things. So, and I'm going to say this several times throughout both of these presentations. If you as a parent feel that something is wrong with your child, it is your responsibility as a parent to be adamant and to advocate for your child through your doctor or whatever resources that you can find that something is different. I need my child to be evaluated. That is your responsibility. And on the other end, it's our responsibility as physicians to make sure that we are listening to your requests and honoring them. You know, sometimes a mom may come to me and say, well, my kid isn't putting 2 words together and their kid is 18 months. Well, I know that that is a 24-month task. And so what I'm going to do is reassure mom, tell mom that I hear her concern, but then I'm going to tell mom, you know, this is when this typically happens, and we have until this point when it is abnormal. Why don't we check back in regularly, and then by the time that I know the range, the time should have come when your child should be doing that, let's come back and revisit it. If at that time the child is not making or meeting a developmental skill, then it is my responsibility to let's pursue this further, whether it be getting speech therapy, occupational therapy, physical therapy, all of the above, or whatever the case may be. Then that is my time, my obligation to get that done is at that time. Hello, Mary. Hello, Destiny. Thank you all for watching. Come on in and tell us where you're coming from. We'd like to know. I know I'm a Birmingham, folks, but tell me if you're coming from somewhere else. All right, so hopefully that is all making sense so far. All right, early intervention, early intervention, early intervention. We know that kids do better when they speak well, okay? And that has to do with a lot of things. People stop and listen to you when you speak well, when you sound like you're about, and so it's also reassuring to the kid to have them to be able to talk well. If people are always saying, what did he say? Or eventually they will stop talking. And it's the skillful listener who can notice the difference between a child who has, for example, selective mutism, who has a speech problem, who's anxious, or who absolutely does have an autism spectrum diagnosis. Clarence, thanks for watching. Indy, that's right, girl. I got my training right there in Indianapolis at IU. And Ashley says, praise God for intuition. We caught my son early. Yes, yes, yes. So Ashley sharing with us that her son has a diagnosis of autism disorders. If you don't mind, just drop in the chat, Ashley, how old he is, because some mother out there is probably trying to wonder, is it okay? And Dr. Brandi B over here, I'm always telling y'all, it's okay. Whatever it is, the biggest thing we can do is to talk about it, to admit we have these problems, and let's get them worked on. Let's get them solved. Let's get these babies some help. All right. There is no medical detection for autism. There's no test for it. We will talk a little bit about that, but I wanted you to know that now. He just turned 3, Ashley says. Okay, thank you so much for watching. Let's see what Mary says. Mary says, that's my Mary from the apple tree. We went to Vanderbilt together, and we were on the hall in the class at our freshman dorm together. She says, hi, Brandi, you look beautiful. Thank you so much, Mary. I'm so glad to be able to catch your chat from Louisville. That's right, Louisville, Kentucky. Early intervention is so important. Oh, my goodness. Yes, it is. Yes, yes, yes. Can't talk about how important early intervention is. I wish my sis Erica was on here, because she always says you can't treat. Oh my goodness. Maybe she'll jump on a little bit later. She could tell us what she always said. All right, let's keep moving it. What causes it? All right. So, mental health, guys, and in medicine in general, sometimes we just don't know. We don't know what causes it, but we do know that there are some genetic links and that there are some environmental links. Okay. When we talk about genetics, we know that identical twins are going to have anywhere from about 36 to 95% likelihood that if one child has it, the other twin has it. 36 to 95 means, to me, we aren't really sure, but we know it's a lot, because that's a wide range. Okay, so we aren't really sure, but we know it's a lot. If one child of an identical twin pairing has it, there is 36 to 95% likelihood that the other child will. Now, in fraternal or non-identical twins, that number drops to 31%. 31% in fraternal or non-identical twins. Now, if we're talking about siblings, if mama wants to know, well, we have a child with autism, what is the likelihood that we will have another? That 31% for fraternal twins drops down to about 18%, 2 to 18%. So that's still, quite a bit, less than a quarter of kids who have a sibling already. If parents are wondering what is the likelihood that another child will have it, 2 to 8%. Okay, so that sometimes will help parents with planning, and then sometimes it doesn't. Everybody says all children are a gift from the Lord, and God gives us these special kids with special needs. He gives them to special parents who are made to do it, and they learn. Even if they weren't made to, they quickly learn to be a good parent to, no matter what the child is that you're given. All right. Older parents, okay, especially if the dad is older. There have been some thoughts about older parents having children who have autism spectrum disorders, and a child with a low birth weight, who is typically going to be a child who was born prematurely. So those children could have autism. Fragile X is a medical condition, and we don't know that about a lot of people because we aren't doing karyotypes, which is where you look at the person's DNA under the microscope, and truly on the X, like girls are XX, boys are XY, truly on the X, it's fragile on the end. It's just kind of hanging there, and you can see that under the microscope, but that can be a cause of autism spectrum disorders, as well as tuberous sclerosis, which is another neurologic disorder. Then there are some environmental things like lead. We've talked about lead when we've had our ADHD discussions. So lead toxicity, you want to watch out for that. If you live in a home that was built and or painted around 1978, because lead was everywhere. Lead was in the paint, lead was in the soil. So if you have a kid who is what we call a mouther, which is going to be any child who's crawling around, they put things in their mouths, those kids are going to be at an increased risk for having a lead ingestion or toxicity, and that can be a cause of autism. What I want you to take away from the cause, though, is that we don't know. In most of these cases, none of these things that I'm talking about, you got a 22-year-old mama, and the dad is 22, and there are no other siblings, and nobody in the family knows about it. Mama did everything right, and she didn't drink, and she had the child at term, and he weighed 10 pounds, and he has autism. Okay, so it's nothing that you did wrong, and there's really nothing that you can do right. It just, that's the child that you were giving. All right, and we can be in awe of them. I think I'm gonna use it. I like that, awe. Let's see, we've got some comments. Auntie Wanda says, how about if a child can hear but can't talk at 5 years old and is always climbing onto things? They can hear, but they can't talk, and they're climbing onto things. So if the child can hear, and that's a very good point. One of the things do, and we'll talk about that, is get a hearing test to make sure that the child can hear, because not responding to your name, to a child's name being called, is one of the things we look for. So again, there may be plenty of reasons that kids can't talk, and that's why we need to get the kids into speech therapy. Hopefully by 5 years old, the kid has already been there. I know a lot of parents that will say, well, he's the boy, or he's a girl, or it's a girl, or she's the second born and her older siblings or whatever talk for her, or we speak Spanish in our house. None of those are reasons for a child's speech to be delayed in development. So if that child can hear but isn't talking, they need to be in speech therapy, first of all. But the most important thing as related to this talk is that no individual symptom makes a diagnosis. So because a kid doesn't talk doesn't mean that kid has autism. Autism is a social disorder. So does that kid still like to be around other people and jump and laugh and play and want to bring you things to show you, and doesn't have the repetitive movements that I'm going to talk about? Then that kid is not likely to have autism. And so there may be selective mutism. There may be some other speech development problem. And getting in with your speech language pathologist is going to be the key there. Thank you for that question. That was a really good question. Let me know if I didn't clear that up for you. Ashley Johnson says, what about babies born to moms with maternal high blood pressure? That is not something I've seen. So like I said, we don't know. We don't know. So if that's something that, we will certainly can look into it, but that's just not something that pops up readily in any of the literature. Chantry says, and speech therapy is so awesome for children. We're huge advocates. We're huge advocates. And over here, just a moment of full disclosure, my second doesn't say his S is right. And so I was like, we got to get him evaluated. And so the speech therapist said, I think he's just young because he just turned 4. And I said, he may be, but I can't be over here talking to y'all every Friday about what we need to be doing, and I'm not doing it myself. So he's in speech therapy, right? And he came home Friday and he said, Mama, Rice Krispies. And he was super excited about saying Rice Krispies because usually he drops S's. probably developmental, but his mama is not taking any chances. All right, we got him in speech therapy, so now I'll be able to share this experience with everybody else about what speech therapy is like. But as Chantry said, it is pretty awesome. Erica is watching. Hello, beautiful sis. Erica, go ahead and drop in the comments, please, for us what you say about whatever you say, basically about admitting when we have something going on. You can't do something. Talk to me. Go, Frankie. Amber says, Amber's in school, y'all. She wants to be a speech language pathologist. Are teachers able to diagnose kids? So that's a good question to my cousin Thomas out of Cleveland. Teachers certainly are the best people. They are frontline folks at recognizing things that we may not recognize. We may compensate and just start talking for our kids. And so teachers certainly can bring things to the attention of parents based off what they notice other kids are doing. But as far as making a diagnosis, probably not. But they certainly can be in on the planning team for getting academic treatments and accommodations in place. But as far as making the diagnosis, no, but they certainly can make a comparison and look at other children to see how other children develop in relation to a particular child. That's a great question. Thank you. Chantry says, go, Frankie. Maurice is watching. Thank you, Maurice. You can't heal what you are not willing to reveal. Thank you, sis Erica. You can't heal what you're not willing to reveal. Deetrice Wright, thank you for joining us. Tell us where y'all are coming from. Kenesha, good response. Thank you. I'm assuming good response to what the teachers can do, because that is coming from my Dr. Kenesha, who is a doctor in education. And so, yes, they aren't necessarily making diagnoses, but they can certainly bring to our attention things that they notice to be different. Amen. Love that. You can't heal what you can't reveal. Renee is watching. Angela Krosky is watching. Thank y'all so much for watching. We're up to 34. Come on. Tag some people. Bring them on over here. Let them know, as usual, we are having a good time over here at Dr. Brandi B. If y'all are having a good time, just let me know. Say good time. All right. Let's see. Where were we? We were talking about the genetics, the causes. So what's the takeaway for the causes? We don't know. All right. Y'all hear my kids in the background? Lord have mercy. Now, I told them I was talking to my friends around the world, and I wanted them to be on their best behaviors. But guess what? They're 5, 4, and 19 months, so they're having a good time over there. All right. So how is it? Good times are rolling. That's right. Great time. Awesome. Thank you all so much. A good time, Dr. Kenesha says. All right. Thank you, Dr. Kenesha. So how's it diagnosed? It's diagnosed by a parent who says, this is different. Let me get this question. Ashley says, what is high functioning? My son was originally diagnosed, but I was told last week he's actually high functioning. Can you please help me understand? We're going to talk about that. Hold on, Ashley. And when we get to that, when we get to the levels, if I don't specifically answer your question, let me know. My auntie Rosa says, my sister was a special education teacher, and she could sometimes talk to a child and say that the child needs speech therapy. Absolutely. Yes, they're having fun. Edna Griffin Henry, come on in. Thank you. Miss Sadie says, good time. Miss Lisa says, learning so much. Ashley says, okay, good. So just remind me. All right. How's it diagnosed? Parents. Parents being suspicious. You are with your kids all the time. Like I said, it's your role as a parent to make sure that your concerns are being addressed. Now, I know that sometimes your insurance may dictate who you can see, but make sure that you are wearing that doctor out about something if you don't think it's right. A lot of times, my pediatrics colleagues, and I'm a pediatrician, board certified, y'all know that, they will say, we're just going to wait, okay? But let's get the kid evaluated. Let's let the experts in that area tell us that it's okay to wait, all right? That's what we want to do. Hi, David. Hi, Margaret. Thank you for watching. All right. Well child visits. Your well child visits in that first year of life are very important. Not only for shots, yes, we give shots over here, okay, at Dr. Brandi B, but It's important because that is the time that your child's pediatrician or family doctor is looking at their development, making sure they're making those milestones on time. Are they cooing by 2 months? Are they making good eye contact? Are they sitting up? And we're not really so much concerned about gross motor development, like sitting up and crawling, which, by the way, the people that come over here to Dr. Brandi B are going to know that crawling is not a developmental milestone. Sitting up and walking are, but crawling is not. So when people say to me, "Oh, girl, oh, my baby's a genius," I just say, "Oh, that is so nice." But y'all are going to know that crawling is not a developmental milestone. I bet y'all didn't know that. I'm just giving away all this good information over here. But that is where these things should be caught, in your well child developmental or well child visits. So while you're asking about the weight is important. But what I want y'all to be asking, mamas and grandmamas and great grandmamas who are taking care of or in any way aiding in your child's care, is to ask, what about socially? How's he looking socially? Because this is the time to catch it. All right. Then we have diagnostic quizzes and surveys that you may be given, like the MCHAT, which is the checklist for autism in toddlers, checklist for autism in toddlers, and then the modified checklist for autism in toddlers. That can start being given around 18 months, but there's several others that can be done even before that. But the CHAT and the MCHAT are among the most common. But your interviews and evaluations with your pediatrician during that first month of life are going to be so key, so key. All right. As far as diagnosis, you've got other blood tests. I talked about fragile eggs and tuberous sclerosis. I talked about some of that stuff that can be diagnosed based off blood tests, but really that is not necessary. Okay, that is not necessary. You do want to get a hearing test. As my auntie Wanda mentioned, you want to get a hearing test to make sure that the child can hear. Ever wonder why children who live in English-speaking homes speak English? Y'all think it's magic? It's not magic. And the people over here at Dr. Brandi B are going to know that. Your children speak English because that's what they hear. So guess what? If they don't hear you, they don't talk. Right? If they don't hear you, they don't talk. Tiffany Turner says, yes. I hate that it's delayed. Hey, Dr. Tiffany, somebody on another lecture was asking where you live in Texas. Dr. Tiffany is my classmate from Meharry, and she's a pediatrician. They want to know, Dr. Tiffany, where you live. So if you don't mind putting it here and going back to last week's when I did Ask the Psychiatrist, y'all know Dr. Brandi be trying to hook everybody up over here. We just stopped in the middle of a lecture and started talking about somebody else because we are trying to help whoever needs it. But go ahead, Dr. Tiffany, and please drop that in the chat where you are located because we want these babies to be taken care of. All right. How's it diagnosed? Not blood test necessarily, but it can be supportive, but a good old evaluation, a good old look at a kid. Now, before we go too far, we talked about what can cause it. Can somebody write in the chat for me what does not cause it? What absolutely does not cause it? Absolutely does not cause it. Can anybody write in the chat for me what absolutely does not cause autism? Anybody know? Anybody know? Nobody? Absolutely does not cause it. Nobody's writing anything. Absolutely does not cause it. Nobody? Okay. Well, I'm going to tell you because you're over here, Dr. Brandi B, so I got to tell you. Dr. Turner, there you go. Vaccines. Vaccines absolutely do not cause it. Now, let me tell you about shots. Allie says shots. I like shots. Vaccines. Cousin Chantrice said vaccines. Vaccines. Dr. Encarica, vaccines. Yes. All my doctor friends, my medical friends who aren't doctors, Alice says shots. I like it. Alice in the mental health field. It's not the mom's fault, is what Mary says. And Miss Lisa says the mother. So the mother didn't cause it. We don't know what causes, but absolutely not is it vaccines. Okay, because I swore that's what happened with my sons. I'm so glad you said that, Miss Ashley. Let me tell you what it is. And Eunice is why. Eunice, vaccine, says Alicia. Yes, thank you. Y'all are smart over here at Dr. Brandi B. And for the ones that did not know that, now you know. Okay, now you know. So when people are talking about I'm not going to give my kids shots because they're going to get autism, you're going to be able to say, well, now Dr. Brandi B said that that is not a cause. And you don't have to take my word for it, right? I want you to just look into it at credible sources. I don't want you to go to these mom sites where that's what they do. Anti-vaccines are us. You don't want to be over there because obviously that's what they're going to say. But remember over here, Dia says vaccines. Remember over here, hey, Jackie, thanks for joining. Hey, Andrea, thanks for joining. Remember over here, we're practicing evidence-based medicine. That's what I talk about over here. Evidence-based medicine, what research has shown us, okay? And that's what we believe, science, all right? If you don't believe in science, this ain't the place for you. We'll talk to you some other time, all right? But I'm here to learn with Dr. Brandi B. Yes, Dr. Eunice. Yes. I love when my doctor friends come because I get nervous. I'm like, oh, Lord, they critiquing me, so I got to say it right. But vaccines don't cause. Let me tell you why vaccines came in. And it's 12:38. So we're going to have to wrap it up because I got to get through these, at least half of this diagnostic criteria, y'all. This is so interesting. Oh, my goodness. I'm going to have to put on a seminar or something. Would y'all come? Would y'all come to a seminar? Let me know if you would come to a seminar. Okay, here we go. 18 months. Dr. Tiffany, am I right? Dr. Eunice, at 18 months, don't you get some shots? Don't you get some shots? You get some shots, okay? But let me tell you what happens with 18 months in autism. That is about the time that parents are really noticing that something is going on with their kids. Some kids, Chantrice said she would come. Oh, Renee, thank you so much. You will have to see the proof of that. Okay, all right, no problem. Miss Renee Ingram, she said she needs some proof. Awesome. We will get you some proof. Front seat, Missy Tucker said, yeah, I would. Cecilia said she come. And Dr. Kara said, absolutely. Help me, Dr. Tiffany. Priscilla said, oh, yes. All right, everybody would come. Okay, hold on. I'm going to be looking for y'all. I'm going to screenshot this. But let me tell you, 18 months, we're getting shots. But the kid is starting to regress about that time. Y'all know that things happen in coincidence, okay? They can. Everything is by design, and I think from God. But about that time, things are starting to really come full circle for a parent, and they're becoming more obvious. And so they may be noticing that their kid is not developing like their other kids did, like their friends did, their friends did, and so they're also getting shots. We're coming in and we're getting some shots. And so that is about the time that is happening. And that is why the MMR vaccine, the shot, that's how the shot thing came to be. But I want you to know that that is not evidence-based, okay? Parents can have their strong beliefs about a thing, and Dr. Brandi B is not going to try to convince you about what you believe because you can't convince me about what you believe. But I believe in science. And if I believe in science for everything else that we do, then I have to believe in science about that. All right? But I respect you, Miss Renee, and I respect Miss Renee. Tell me where I know you from. You can send it in my inbox. I can't see these little bitty pictures, y'all. I'm sorry. But I at least want you to know what science says so that when you're talking to people, you don't have to get upset because Dr. Brandi B is not going to get upset. I'm going to just say that's not what science tells us, and if you like it, I love it. And I'm not being funny. That's just what it is. Ashley says that makes sense because he was doing so well, then he regressed socially. He's still super affectionate, and I'm so grateful for sharing your knowledge. But you know what, Miss Ashley, more than anything, I'm grateful for you because at 12 o'clock on a Friday or 1 o'clock in your time zone, wherever you may be, if that's the case, you're here with me. And so I thank you for spending time with me. I thank all of y'all. We're up to 37 on a Friday, and we're having a good time. And I hope y'all come back and I know we're going to do this again. All right, let me get busy. Y'all know Dr. Brandi B be talking. Y'all know Dr. Brandi B be talking. I get excited. Okay, here we go. Waisha says she's watching. Thank you so much, and thank you for sharing. Miss Renee says your son is my patient. You ain't got to tell everybody, Miss Renee. I still can't. I can't see. I'm going to check that out on the break, Miss Renee, and try to see if I can figure out who you are. But don't tell me. I don't want nobody to know. Break confidentiality. All right. Y'all having a good time? I hope y'all having a good time. Let's see what we're going to talk about now. We're going to talk about diagnostic criteria. Okay. Y'all ready? Here we go. So, autism has two main sets of criteria. Y'all still with me? Let me know. Just like a love or something. Somebody send me some love. Send me some love, y'all. All right. Autism has two sets of criteria, two main sets of criteria. There's social interaction and social communication. She says too late. And then there is the restrictive and repetitive. Oh, thank y'all. Y'all so kind. The restrictive and repetitive patterns of behavior, interests, and activities. All right. So social communication and social interaction, and then the restrictive and repetitive patterns of behavior, interests, and activities. All right, here we go. Thank y'all for the love. Y'all so kind of Dr. Brandi B. We're up to 34 people sharing in this love. I appreciate y'all too. All right, here we go. Deep breath. Because this is a lot, y'all. So I'm going to read a lot of this because I've, over the years, acquired a lot of examples, and I want to share them with you because you may be thinking, does my child have it? And so it really doesn't matter where it came from, right? We got to treat this thing now. Type again, Sis Erica, what it is, what we got to do. Here we go, social communication. So there are three things, three sub-criteria under social communication and social interaction. The first one is going to be social emotional reciprocity. Reciprocity means give and take, back and forth. That's the first one. You got to have one of that. The next one you got to have is some deficit in nonverbal communication. Okay, nonverbal communication. And then the third one is going to be maintaining, establishing, and understanding relationships. Cousin Tommy says, how many pills does a child have to take? We'll talk about that. We probably won't get to that till 6 o'clock Central Standard Time. But thank you, Sis Erica. You can't hear what you won't reveal. There's no treatment for autism per se. There's no treatment for autism per se. We're going to talk about how you get diagnosed. It's probably going to be in the next hour or two. Alicia. All right, let's go over some things. Social emotional reciprocity. That means they come in and they don't understand that conversation is a back and forth. I talk, then you talk, then you talk, then I talk. We talk about I want to talk about. We talk about what you want to talk about. Then what I want to talk about. Then you would. If you find yourself in a one-sided conversation, that may just be somebody who just like to talk. But that's one thing that you want to stick off in your mind. They don't understand that play is back and forth. Your turn, then my turn, your turn. And we're taking turns. And so a lot of kids won't want to play with them because they'll always say, he doesn't share. All right. Hi, Miss Rosa Short. Thank you for watching. He doesn't want to share. They talk about at length about one particular topic. Trains, dinosaurs, fire trucks, cars. Okay. Those are things I hear a lot of. Thomas the Train. Now, if your kid likes Thomas the Train, Dr. Brandi B don't want you to leave here saying, my kid ain't got autism, does he? Listen, folks, one individual symptom does not make a whole diagnosis. You got to put all of it together, okay? Not looking at things shown to them. That's called joint attention. So if they don't respond to their name, which is another thing, you call their name. If they don't turn around and respond, then that's the first problem. But a kid or a person, if you call their name, somebody says, hey, Dr. Brandi, I should turn around. And if they're pointing, I should look, right? I'm going to first turn when I hear my name. And then if they're pointing, I'm going to look without them saying anything. That's called joint attention. We're sharing attention on the same thing. That is something that is commonly seen in children with, all the dinosaurs over here. Yep, that's my NB. He's obsessed by one subject. That's right. Oh, NB is your child's initials. I'm going to have to check it out. I'm going to check it out, Miss Renee. I appreciate you being over here with me today. Reduce sharing of interests and emotions. So let's say they like dinosaurs, but I talk about staple machines. They don't want to talk about that. And they can't understand that I get a chance to share mine too. Okay? Missy Tucker says, that's my child to a T. All right? Does not understand simple questions or statements. So parents will say, it's almost like the kid doesn't understand what I'm saying. They may not. Because remember, it's language, it's communication. It has nothing to do with how smart they are. They just may not get it in the way that you're saying it. All right. Not giving people a chance to respond. But the biggest thing I want you to take out of this social emotional reciprocity is back and forth. Your turn, then my turn. My turn, then your turn. Your topic, then my topic. That's big. If you find that all this kid wants to talk about is cars, and they know more about this particular car, they can tell you, like, give you professor level type of conversation. That is a little bit interesting. I'm not saying that their child has autism, but that's interesting. Okay, deficits in nonverbal communicative behaviors used for social interaction. All right, not respecting people's personal space is huge. So they get up on you, run up on you, okay? Run up on you. Now, that could be a person who has ADHD and they're impulsive. And we talk about ADHD a lot. I'm sorry, y'all. Had a kid yesterday who the daddy says he runs up on people. But the next thing he told me was important. He said, but when he realizes that he's run up on his frail, as he called him, grandmother, he says, oh, I'm sorry. That's the difference. The child with autism is not likely to recognize that you could have broke grandmama's hips tackling her like that. Okay? They just run up on you. And then if you go, whoa, they come closer. They don't understand. Okay? Hey, Miss Perline. Hello. That's my cousin Alejandro. Thank you. Thank you all so much for joining. They don't understand that they've gotten too close. They don't recognize when others are tired of a conversation. So you could be like, oh, sleepy. Looking at your watch, shaking the child, gathering up your belongings. They don't get it. They keep talking about cars. All right. Eye contact. Now, parents will say, he'll have eye contact if I hold his chin and make him. All right. So there are a couple of different things about eye contact. Eye contact can be typical, like what you see me looking at you out there. I see y'all. Eye contact can be like abnormal. They can make eye contact, but if somebody's staring at you, that's not typical, okay? You should blink. And if you're staring at someone and they make eye contact with you, you typically look away. Like, ooh. Now, let me tell you about gaze aversion. Yes, they definitely have a problem with social cues, Mary. Yes. I missed a comment up here. Obsessed by one second. Okay. Gaze aversion is when they're looking at you and then you look at them and they look away. That's called gaze aversion. Okay. So they like to make eye contact, but it's just really uncomfortable for them. Really uncomfortable. Or they could just flat out have no eye contact, and then they could just talk to you like this. Yeah, I'm having a great day. It's a great day. Everything is going good. Okay? All right. No facial expressions, flat, not recognizing other people's facial expressions. That can be a problem. Body gestures, body language, that's very difficult for them. And we know that nonverbal communication is very important because there are memes and GIFs that talk about, Lord, fix my face, or Lord, don't let my face say what my mouth won't, right? So now masks, we're covering up all of this. But I've gotten really good at looking at people's eyes. If you smile, the eyes get smaller. So even if a person has on a mask, you can still see that, or wrinkle in the forehead. So there's still a lot that can be seen even with a mask, and sometimes they miss that. Hey, Della, thank you for joining. All right. They don't do any pointing, like over there, and then sometimes they use pointing in place of talking. All right. And then number 3, unless you have Botox. Hey, Dr. Dornicia. She says, if you have Botox, she's a dermatologist, y'all. She says if you have Botox, you might be not be able to wrinkle your forehead. Hey, Attorney Fred, thank you for coming on in. You called me. You know I'm talking to my friends all over the world, and you called me. But that's all right. All right, so we got it, y'all. Social emotional reciprocity. Deficits in nonverbal communication. And nonverbal communication is big. Hi, Erica. Thank you for joining. That's Erica. Thank you. All right. Then the last part of this social, communicative, and social interaction piece is going to be deficits in developing, maintaining, and understanding relationships. Now, this gets a lot of teenagers into trouble, especially. So when I ask a question, now, I just want y'all to know, when I'm interviewing your child, if you ever come to see me or if you've ever watched me do an interview or heard me do an interview, it seems like I'm being really intrusive, but everything I ask you is for a reason. So I'll ask a kid, what's your best friend? Who's your best friend? And at about kindergarten, first, second grade, I expect them to be able to tell me one. If they either can't name one or they name 20 people, that's a red flag. I'm not saying they have autism, but I'm just saying that you can't have 20 best friends. Adults, we know you can't do that. And so there's a lack of understanding about relationships there. I will ask the question, do they get invited to birthday parties? And their parents say, well, yes. And I say, well, who? Well, cousin Sally, cousin Angie, cousin Tamika, and cousin Anna. No friends? No, the friends don't invite them. Okay, at 5th and 6th grade, so then I ask the kid, do you hear kids talking about parties? Yeah, they talk about them. Okay, that's another clue. And then when you get to high school, I always ask the question, so don't get mad at me, parents. I always ask about, are you related to boys, girls, or both? And that's because I need to know about bullying if the child is related or attracted to someone of the same sex. That's a risk for bullying, depression, and even suicide. So I ask. So then they say whatever. And then I say, well, are you dating anyone? And they may say, yeah. And the mama's like, I've never heard that name. Or the mom may say, that child goes to church with us. But they've exchanged numbers, and they think that person is the one that they're going to marry. Or they think that person is their girlfriend. What happens a lot of time, getting into another point, they may have difficulties. Mrs. says, I'm the best. Oh, we need to talk about this in our doctor visit. Oh, Mrs., that's the reason I'm doing these, Miss Misty, because it's just not a time. It's not enough time. That's why I want y'all to tell people to come on over here to Dr. Brandi B, where they can get this unlimited but limited time. Y'all know I got 3 kids. They can get this good education over here because it's so important. And to be honest, my colleagues don't understand this. And we can't hold that against them. We just got to tell them to come watch Dr. Brandi B too. All right. Age match friends is important. So if I ask you, how old are your friends? I'm not being nosy. It's because I want to know, are your friends your age? Are they older or are they younger? If your friends are all older, and I'm talking about kids in the realm of autism, if all of your friends are older, a lot of times what's happening there is that they are looking at that kid as, oh, look at my little sister or my little brother. But they think that those are their friends. If the kids are younger, then developmentally, that may actually be where the child is, and so they feel comfortable over there. So a lot of times they're with younger kids, all right? And that's why, all right? Very seldom are they truly in friendships with people their age. Now, let me tell you about the true friends who are their age. Oftentimes I'll say, well, mama, how is that friendship in the same match, age match child? And the mama will say, well, that child doesn't have any other friends. Okay, that's another red flag. If they have found each other and they are each other's only friends. Hi, Dr. Andrea. Hi, Reggie. Thank you for watching. Hi, Teresa. Thank you for watching. If they are each other's only friends and that child has no other friends, and you say, they are alike, then probably that other child has something similar to autism too. Not necessarily. I'm just giving you generalities, right? So all of this is for education purposes, right? And I am not treating your child as an by this message here, even if I treat your child. All right? You got to ask me about your child when you are paying for me to see your child. Okay? All right. Y'all know I'm just over here having fun sharing knowledge because that's what I do. They prefer to be alone. So check this out. Some parents will say, but my kid can't have autism. He likes being around us. Okay, great. This sounds good. When he's in the room with you, is he talking to you and interacting with you? Or is he in a room or in an area by himself? You don't have to answer right here. Just think about that. They love solo play. Okay, so even in a room with other people, they are. Oh, Dr. Eunice, you say I do it well. That's so special. Y'all, it is really touching to me when my colleagues come over here and they say good things about me. I don't take that for granted, y'all. I really don't. I'm just grateful to God. And do y'all know that every day before I come on here with y'all, I pray to God and I ask him that he will just use me and let me say words that can help y'all. I really do, because it's not about me. It's about him. And anybody that works with me, they know that I say, what do I say, y'all that work with me? I just want to help these babies. That's what I want to do, these babies. Let me finish up and then I'm going to come to Dr. Dornicia's question. Absence of interest in peers. So it's really tricky here. Let me talk about this real quick. Saw a kid yesterday. The dad came in and he had concerns for autism in his child. This child, I think, was probably in middle school. Now, the camera was off. And so telemedicine is good because the camera was off. They know that I'm there. I'm finishing up my note or doing whatever else I got to do. Get a sip of water, because you sit in the camera all day. We do have to step away, y'all. We have to step away. And so I hear the dad and his child interacting, and it sounds like pretty typical interactions to me. And I'm like, yay. So I was shocked when dad said that. Dad said that his child had trouble making friends. And so at some point ago, there had been some conversations about, does this child have autism? And I don't know what happened, but they did not complete the series to get the diagnosis. And so he told me that he has struggles with making friends, but he has one other friend, and that friend struggles. So I'm like, well, maybe so. But then I went on to learn that this child was bullied. And so this child just felt inadequate in his ability to be cool like the other kids. So he would stand on the outskirts, like trying to figure out how to do it. But I asked some key questions. I said, do you feel like you're going to do or say the wrong thing when you're around other people? Yes. Do you feel like you're being judged? Yes. Do you want friends? Yes. But he just didn't know how to do it. And so it lended itself more to anxiety because he didn't have anything else except for trouble making friends. And so that's why it's important that when you're going to people, that they are very comfortable with making this diagnosis. Let me see if there are any others with relationships. Cuddling, I want you to know that the senses in children with autism are very, 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 they can be hyper, where they just feel too much and experience too much in the world, or they can be hypo, where they really just don't feel a lot at all. And we're going to talk about that. All right. What time is it? Imaginative play. Let me tell y'all about imaginative play. Imaginative play is a type of language, right? It tells us about social skills, right? A mom last night told me that her kid liked Legos. And so up there with fire trucks, cars, and such are Legos. This mom said her child liked Legos. And I was like, okay. But she said he would recreate the figures on the box, the images on the box. He would recreate them. That's not imaginative play. That's that good. They have excellent memories, y'all. A lot of them have excellent memories and can recreate, reproduce, remember stuff on the spot that they've seen only a few times. And so this kid would recreate these elaborate figures made from Legos on the box. All right. So what have we talked about? We talked about what autism is, autism spectrum disorder. We talked about who can get it. We talked about why it's called a spectrum. We talked about the fact that autistic disorder, and we talked about the fact that Asperger's, that name, nomenclature does not exist. We talked about what causes it, which we don't really know, okay? But we do know that there are some genetic components. We talked about what does not cause it, and evidence consistently shows us that vaccines, shots, immunizations, whatever you call them, do not cause it. We talked a little bit about how it's diagnosed, and that's with people that are around just having a keen sense of something is unique about this child and bringing it in. Hi, Keena. And then we went over the first set of criteria, which talks about the social piece as far as social interaction and social communication. We know that there are 3 types. You have to have 1 in each of these. Hopefully y'all are writing them down, but if not, no big deal. We talked about how you have to have some limitation in social emotional reciprocity, which is understanding that language and play is back and forth. My turn and your turn, my topic and your topic. We talked about nonverbal cues and how recognizing that being too close to people, what people's faces are saying, what people's bodies are saying, all those things are very important. And then we talked about relationships, maintaining them after we establish and develop them. All right. Now it is 1:04 over here in the southern, let me see. The next one is pretty big. I do have a question. Somebody says, Dr. Dornicia says, hi, Sharon. Thanks for joining. How have you changed your assessment, if at all, given that the kids have been relatively forced into isolation? I found a lot of kids' relationships are changed or broken. Parent history. So in the DSM-4, and y'all forgive me, hopefully I'll be feeling better next week. In the DSM-4, there was an age requirement of that all these symptoms had to occur before age 3. They've since, that's not as stressed, but we know that it's about development and what that kid did before they turned 3 or were very young in development. So I couldn't make a diagnosis of autistic disorder based on what's happened in the last 6 months. This is over time. Your kid would have been doing these things for the last 6 years, not 6 months. So the diagnosis or assessment of autism, if they start talking about he was fine up until this, he's never lied anything or done anything else, then we're going to call that, in my world, an adjustment disorder or something else. But you got to give me history about what the child did when he or she was very young. And Ashley says, that's my sunshine. He's always cuddling. The key about cuddling, though, is that you have to either know that child and what they like or let them initiate it. You will notice a lot of times they give side hugs because just the thought of getting that close and hugging them is just too much. It can be too much. It can be too much. All right, guys. Did y'all have a good time? Katrina, hi. Thanks for watching. I hate to stop, but I'm going to stop here because the next one I know is long. And it's going to talk about some of these restrictive and repetitive patterns that they do, kids with autism. And I want you to understand, when I say they, I am not in any way trying to diminish or insult anybody's, their child or their own worth, abilities, value, or anything else. But that's just kind of the way of grouping it. Otherwise, I'm saying ASD, and it's they. And actually, like I said, with the Asperger's crew, they were proud to be a part of the Aspies, as they call themselves. All right, any last minute questions? There are 35 of y'all here. Tell your friends when we're coming back at 6. All right, got to do a wardrobe change because y'all know I'm extra over here, Dr. Brandi B. But yeah, when we come back, we're going to talk about the other set, the restrictive patterns, and it's a lot of them. And we're going to talk about, what else we're going to talk about? We're going to talk about the functioning, high functioning, low functioning, what that means, how that's really not medical terminology. We're going to talk about when you should see your doctor. We're going to talk about treatments. And we're going to talk about some lookalikes because there are some people who may meet these criteria but not the next set. And 6 p.m. We're going to come back at 6 p.m. and Central Standard Time. And we'll talk about all of that, okay? Any last minute questions before we go? If not, y'all get back to work and I will see you. Bring your favorite beverage when we come back. We're going to have a good time. All right. You know I love y'all. I really do. And because we are parting, I'm going to tell you who I am. I am Dr. Brandi B, your triple-boarded child and adolescent psychiatrist. I help worried, overworked, overwhelmed, stressed out, does my child have autistic or autism spectrum disorders mamas? I help y'all figure it out so we can be educated and we can be engaged and get these babies the help they need. Alicia, clarify your question. You said diagnosis. Are we going to talk about it? We're going to talk about diagnosis when we come back. Is that what you're asking me? We love you. You're a blessing to my family, and you are a blessing to mine as well. I love all of y'all. We are 34 strong over here, and I'm just a little old girl from Birmingham, Alabama, just out here trying to let God use me in the best way that he can. Is it possible to have more than one child with autism? Ooh, Miss Waisha. What y'all gonna tell Miss Waisha? What y'all gonna tell her? What y'all gonna tell her? Hezekiah, thank you for watching. Somebody come on in here and tell Miss Waisha. Tell her, somebody. Help me. Is it possible to have more than one child with autism? Where are my busy bees who've been here since the very beginning? Yes, says Alicia. It is. Margaret News, you were here at the beginning, girl. She said yes. Fred says yes. So yes, right. Miss Eunice says yes. We talked about it at the very beginning. 36 to 95% of both twins, if they're identical, will have it. If they are fraternal or non-identical, it's going to be 31%. Both of them will have it. And it's 2 to 18% if you have one child with it, that you will have another child with it. Yes, yes, yes. Y'all were listening. All right, my busy bees over here. We giving out tests over here. Hi, Angela Gilroy. I hope I said that right. Thanks for joining. All right. I saw something else. Miss Keena says, thanks, very good information. I appreciate you taking the time out of your busy day. Oh, we're just having fun over here, Dr. Brandi B. God blesses me when I bless others. Hey, Alethea. All right, Alethea says, yes, it is. Y'all were over here at the beginning, and y'all didn't say hey to Dr. Brandi B. All right, when y'all come back at 6, come on in and tell me hey. You know I'm going to be looking for y'all, too. All 39. I'm going to be looking for all of y'all plus a friend. Let's set some records over here, Dr. Brandi B. All right, y'all. Bye.